So, good morning, doctor. Would you please give us a little description about yourself?
Good morning. I'm Dr. Dev and I'm the cardiac surgeon here at Durdans. I've been here since 2004 and I have over 30 years of experience in cardiac surgery, and even in Durdans I have performed over 10,000 major cardiac operations.
What is your specialty here at Durdans?
We do all kinds of the adult type of cardiac surgery operations. The main one, of course, is the bypass surgery. And here we specialize in using arterial grafts for bypass surgery, and we also specializing in beating heart surgery. So that means we are going to get that will translate into good long-term results.
What usually causes someone to have a bypass surgery?
Usually people get blockages due to several risk factors, and the risk factors are diabetes, high blood pressure, high cholesterol, smoking, a not so healthy diet, and most important, hereditary.
Normally, how long does a bypass surgery take?
Well, the whole thing takes about 4 5 hours. The surgery itself is only about 2 2.5 hours, but there are a lot of preparations, anesthesia, various things. So the whole process is about 4 5 hours.
Is it a relatively safe procedure?
Yes, it's very safe. The risk of a surgery nowadays is 1%.
Can you sort of describe the recovery process, how it happens?
Usually, we admit the patient one day before surgery, and the following day will be the surgery. By the evening, the patient is awake, and by next day morning, he may be sitting up and having his food. By the first day evening, sometimes they are sitting out of bed, and certainly by the second day, people are walking about. We have a system in which they stay in the ICU for 3 days. After that, they go to the room where they mobilize and they climb the steps, and everybody is ready to go home by the fifth or sixth day.
What can you expect to feel when you wake up from the surgery? Like a lot of pain or delirium? Maybe you're disoriented, or is it you wake up and you feel fine?
Actually, it's not as bad as people think it's going to be. When you wake up, you may have a tube going into the throat, but it will quickly be removed. After that, it's quite easy, and the pain is never as bad as people expect.
After surgery, is there a lot of scarring or damage?
The standard incision, of course, is a line down the chest, and there are some methods to try and minimize the scarring. Of course, the best method of reducing the scarring is to do keyhole surgery, which, of course, not possible in everybody, but those who are suitable, they will benefit from a keyhole surgery.
So you've spoken about recovery from surgery in the short term. What should be done in the long term, and how does Durdans get involved in that?
In Durdans, we are really focused on doing surgery in such a way that the patient has a very good long-term result. For example, we do beating heart surgery. Number two, we do bypasses with arterial grafts. Even the way we take a vein for the surgery has been statistically shown to have very good long-term results. And there are many other things as well. For example, we have a protocol of minimizing or completely avoiding blood transfusions. All these steps, one by one, will translate into much better long-term results. So we really want a person to be free of hospital for a long time.
So after some surgeries, even after you recover, you feel worse. Will you feel better after bypass surgery?
Yes, provided you give a short gap of about 2 to 3 weeks, you should be able to do more work and more efficiently than you were doing before. In fact, one of our patients after 2 months has gone to the Everest Base Camp.
Will a person need a caretaker after they recover? They leave, in order to recover when they leave the hospital.
Usually, family members are in more than enough to do the daily care. In the event that there is not any suitable person, I think the Durdans home care will take care of that.
When can you start to socialize with friends and get back to your normal routine?
We usually ask patients to stay at home for about the first 2 to 3 weeks, and we like to minimize visitors to prevent infection for a couple of weeks. But after that, we encourage everybody to go out and meet a few friends And of course, you can socialize, but we always we advise about the diet and avoidance of smoking, including passive smoking. Alcohol, we don't really mind, but we prefer it to be kept to a small amount occasionally.
After surgery, are there any symptoms to look out for? Any sort of danger symptoms?
Usually, there's nothing, no problematic issues. But if somebody has a fever above 100, or if they get unusual pain or something like dizziness or any other symptoms like a cough, then we ask them to get back to us. We always in touch over the phone and WhatsApp nowadays.
Can you engage in sexual activity afterwards?
Yes, we generally feel that it's better to give a gap of about 4 to 6 weeks, after which it's quite safe.
So, how does diabetes affect you after a bypass? Are there any increased risks if you're a diabetic?
If your diabetes is controlled, actually, I think it has very little effect. But if it is not controlled, then you are prone to wound infections, wound healing problems, and so many you're prone to other complications like renal failure and various other things. So it all depends on whether the diabetes is controlled or not.
Do you have to restrict your food after bypass surgery?
Yes, every patient is counseled by a dietitian before going home, and we advise a low-fat, healthy diet, which includes a lot of vegetables and more of vegetarian kind of thing, and to avoid red meat in particular.
Can you do any sort of exercise after surgery? Is it advised or?
Actually, some exercise is mandatory, and the physiotherapist advises everybody what to do. And basically, we want everybody to walk and increase it every day, and gradually build up to levels that were more than what they were doing before the surgery.
So, cardiothoracic surgery is a very highly skilled field for a doctor. What made you feel that you should get into that?
I think some doctors like surgery, so I think I'm one of them. But I think the thing that really attracts about cardiac surgery is we're doing something that will really help patients in their important years of life, and it will not only prolong their life, it will make them more useful to the family, to the society, and to themselves. So that's what really, if you help somebody out to live a better life, nothing like it.
What can you say about Durdans Heart Center? It must be one of the only places in Sri Lanka that actually do this type of surgery.
Actually, Durdans has been performing heart surgery for well over 20 years. And over the years, the type of surgeries have evolved. Now we do beating heart surgery with arterial grafts, which lasts people a long time. We have now started keyhole surgeries, and every month we expand the pool of patients who are suitable for keyhole surgery. We do a lot of difficult and complicated cases which would otherwise be in trouble. So I think over the years, Durdans Heart Center has not only got good equipment, but we have got the experience to deal with difficult cases, and our results have been audited and found to be very good.
Do you have any final thoughts on what it is you do?
So just to say that I think that when people think about cardiac surgery, they get upset, they get scared, they are not sure what or whether they're going to survive the whole thing. In truth, it's really not so as bad as it is, and it's quite common. It's not very risky, and it will help you live a better life. So I think we need not be very scared about it. That's what I would like to say.
So, thank you very much, Doctor, for your time, and I will let you continue your good work.
Thank you.